Hi, my name is Maya Sorotos, and today I'm going to be talking to you about strokes. So, what is a stroke? According to an article found through the National Institutes of Health's National Library of Medicine, a stroke can happen when there is loss of blood flow to part of the brain. This may result in the cutoff of oxygenated blood and other nutrients to that part of the brain and cause brain cells to be damaged and die within minutes. Signs and symptoms of a stroke can include difficulty speaking and or understanding what others are saying, confusion in a conversation, slurred speech, numbness, weakness, or paralysis in the face or body. This normally affects either the right or left side of the body. Trouble seeing in one or both eyes, including blurry vision, blackened vision, or seeing double. A sudden, intense headache, vomiting, and a loss of balance or coordination. Different types of stroke. There are 3 different types of stroke. These include ischemic stroke, hemorrhagic stroke, and a transient ischemic attack. Ischemic strokes are the most common type of stroke, and they make up 87% of all strokes that occur. This type of stroke happens when blood flow to the brain through an artery is blocked, normally by a blood clot or plaque in the arteries. Hemorrhagic stroke. This type of stroke can occur when an artery in the brain is ruptured or begins to leak blood. This may be caused by high blood pressure or an aneurysm. The leaked blood can put an immense amount of pressure on and cause damage to brain cells. Intercerebral hemorrhagic strokes are the most common type of hemorrhagic stroke. These can occur when an artery in the brain bursts and floods the neighboring tissue with blood. A subarachnoid hemorrhagic stroke is less common. These can occur when there is bleeding between the brain and the tissue that surrounds it. A transient ischemic attack. These can also be called a TIA or a mini stroke. This occurs when blood flow to the brain is blocked for a short amount of time, such as a few minutes. This can be an indicator of future more severe strokes. These are often caused by a blood clot. After experiencing a transient ischemic attack, a patient's healthcare team can work to develop an action plan that will lower his or her risk of future more major strokes. Risk factors for stroke. These can include conditions, behavioral factors, family history, and other risk factors as well. So some conditions that can contribute to a person's risk of stroke are high blood pressure, high cholesterol, heart disease, diabetes, sickle cell disease, and of course, previous transient ischemic attacks. Behavioral factors include unhealthy diet, obesity, physical inactivity, excessive alcohol intake, and tobacco use. A person's family history of stroke may genetically predispose them to experience a stroke at some point in their lifetime. As for the other risk factors, people over the age of 55 are more likely to experience a stroke, and their risk will double every 10 years after the age of 55. Women are more likely to experience a stroke and to die from a stroke than men are. Black, Hispanic, American Indians, and Alaska Natives are more likely to experience a stroke than their non-Hispanic, white, or Asian counterparts. Diagnosis. A physician can diagnose a stroke through a series of tests including carotid ultrasound imaging, catheter angiography, a cranial or head ultrasound, CT perfusion of the head, lipoprotein A blood test, and an fMRI scan of the brain. In an emergency situation, anyone can identify the occurrence of a stroke using the acronym FAST. F stands for face. If the person's face is drooping or numb on one side, they may have experienced a stroke. Arms. If the person cannot raise both of their arms and hold them up, they have probably experienced a stroke. S stands for speech. Is the person slurring their words or not making sense in a conversation? If they are, they have probably experienced a stroke. T stands for time. This means that the person should monitor the time since symptoms began and make sure to inform EMS or physicians of how long they were experiencing symptoms. Treatment. Emergency treatment for a stroke can include thrombolytic, anticoagulant, or antiplatelet drugs being administered to dissolve or prevent future blood clots. Surgery can also be used to clear the artery where a blood clot occurred to restore blood flow to the brain, or surgery to fix damaged brain tissue may also be done. Prevention. This can include diet changes, increasing physical activity, quitting smoking, etc., or taking blood thinners regularly. Rehabilitation. A physician may recommend any combination of physical, occupational, speech, and psychological therapy to improve a person's long-term effects of having suffered a stroke. The long-term effects of a stroke can include paralysis, numbness, or a strange sensation in body parts, difficulty thinking, learning, forming, and understanding speech, trouble chewing and swallowing, or depression. These are my sources. Thank you.